Hey there, welcome back to our channel. Before we begin, please like and subscribe. It really helps us grow. Thank you for being here. Obsessive Compulsive Disorder, OCD, is a mental health condition that causes unwanted and distressing thoughts, feelings, images, or impulses called obsessions. These are often followed by repetitive behaviors or mental acts known as compulsions. These compulsions are aimed at reducing anxiety caused by the obsessions. So what actually happens in the brain when you have OCD? That's what we'll be exploring today. But before we dive into the science behind OCD, it's important to understand what the disorder is all about. Let's start with the basics. Obsessions are intrusive, unwanted thoughts, images or impulses that cause anxiety or distress. Common examples include fear of contamination, need for order and symmetry, aggressive or sexual thoughts, and religious or superstitious fears. On the other hand, compulsions are repetitive behaviors or mental acts that a person feels driven to perform in response to their obsessions. These behaviors are aimed at reducing anxiety or preventing dreaded outcomes. Some common compulsions include excessive washing or cleaning, checking, counting, arranging, repeating, and avoiding. To be diagnosed with OCD, a person must have experienced these obsessions and compulsions for at least an hour a day, for at least one day in the last 12 months. Additionally, they must have recognized the obsessions as being a part of their own thinking, rather than outside influences. It's also important to note that OCD is not just about being overly neat or organized. While some people with OCD may have these traits, they also experience significant distress and impairment in their daily lives as a result of their obsessions and compulsions. Now let's delve into the underlying causes of OCD. It's important to understand that OCD is a complex disorder with multiple contributing factors. Genetics, personality traits such as perfectionism, and environmental factors can all play a role. One of the leading theories in the field is the cortico-striatal thalamic model, which proposes that abnormalities in the neural connections between the cortex, striatum, and thalamus contribute to the development of OCD symptoms. Another theory is the behavioral inhibition model, which suggests that OCD is linked to an increased sensitivity to threat and an overestimation of harm. This leads to heightened anxiety and the development of compulsions as a way to reduce the perceived risk. There are several treatment options available for OCD, including psychotherapy and medication, exposure and response prevention therapy. A form of cognitive behavioral therapy is highly effective in treating OCD by gradually exposing the individual to the situations or objects that trigger their obsessions while helping them to resist the urge to perform compulsions. Medication, particularly selective serotonin reuptake inhibitors, SSRIs, can also help reduce OCD symptoms by targeting neurotransmitters involved in mood regulation. Now that we have a better understanding of OCD, let's explore the science behind the disorder. Using advanced neuroimaging techniques, such as functional magnetic resonance, imaging fMRI, and positron emission tomography, PET researchers have been able to observe the activity in different regions of the brain when individuals with OCD perform tasks related to their obsessions and compulsions. Studies have shown that there are several key areas of the brain that exhibit altered activity in individuals with OCD compared to those without the disorder. One of the most notable differences is in the orbitofrontal cortex, OFC. The OFC is responsible for a variety of functions, including decision-making, social cognition, and emotional processing. In individuals with OCD, the OFC shows abnormal activity when processing information related to the individual's obsessions. For example, when presented with a stimulus that triggers a fear of contamination, such as a dirty object, the OFC shows heightened activity. This suggests that the OFC is playing a role in the generation and maintenance of obsessive thoughts. Another area that has been implicated in OCD is the dorsal lateral prefrontal cortex, DLPFC. The DLPFC is involved in working memory, attention, and cognitive control. Studies have found that the DLPFC is less active in individuals with OCD when performing tasks that require them to suppress their obsessive thoughts or resist the urge to perform compulsions. This suggests that the DLPFC may be contributing to the difficulty
that individuals with OCD experience in controlling their thoughts and behaviors. In addition to these cortical areas, studies have also revealed abnormalities in the subcortical structures of the brain, particularly the basal ganglia and the anterior cingulate cortex.
The basal ganglia are a group of structures that are involved in motor control, but also play a role in goal-directed behavior and habit formation. In OCD, the basal ganglia show reduced activity, which may contribute to the repetitive and ritualistic nature of the disorder. The anterior cingulate cortex, a structure within the basal ganglia, has been found to be smaller in individuals with OCD, suggesting that it may play a role in the development of the disorder. Furthermore, the findings from neuroimaging studies have shown that there are altered connections between different regions of the brain in individuals with OCD. Specifically, there is increased connectivity between the OFC and the basal ganglia, which may contribute to the persistence of obsessive thoughts and compulsive behaviors. But what does all this neuroimaging data tell us about the experience of living with OCD? To get a deeper understanding, it's essential to look beyond the brain activity and explore the real-life struggles faced by individuals with OCD. Many with OCD report feeling ashamed, isolated, and misunderstood. They often feel the need to keep their struggles hidden from others due to the stigma surrounding mental health conditions. This secrecy can lead to increased feelings of loneliness and make it difficult for individuals to seek help and support. Living with OCD can also take a toll on relationships. The obsessive thoughts and compulsive behaviors can cause significant distress and affect the ability to connect with others. As stated by the International OCD Foundation, individuals with OCD may become socially isolated due to their condition. The repetitive behaviors associated with OCD can also be physically and mentally exhausting. Performing compulsions such as excessive cleaning or checking can become time-consuming and interfere with daily activities. Moreover, the constant anxiety and worry caused by the obsessions can lead to physical symptoms such as insomnia, fatigue, and muscle tension. It's important to remember that OCD affects each person differently, and the severity of symptoms can vary widely. However, despite the challenges they face, many individuals with OCD find ways to cope and manage their condition. With proper treatment and support, people with OCD can learn to control their thoughts and behaviors and live fulfilling lives. But what if someone you know exhibits some of these signs? How can you determine whether it's just a quirky habit or something more serious like OCD? Here are 5 signs that it might be time to talk to your loved one about their behavior. Number 1. Their behavior is causing distress or impairment. If you notice that their compulsive behaviors are causing them significant emotional distress or are interfering with their daily life, work, or relationships, it could be a sign that they're struggling with OCD. Number 2. They are spending a lot of time on compulsions. If you notice that your loved one is spending an excessive amount of time on seemingly meaningless tasks, such as cleaning, checking, or counting, this could be a sign of OCD. Number 3. They are avoiding everyday activities. If they've started avoiding everyday activities or places due to their obsessions, such as avoiding public transportation because of a fear of contamination, this could be a cause for concern. Number 4. They are secretive about their behavior. If they're being secretive about their behaviors, or seem embarrassed or ashamed when asked about them, it might indicate that they're struggling with OCD and the stigma associated with it. Number 5. Their behavior is causing them significant distress or impairment. If their behavior is causing them significant distress, or is interfering with their daily life, work, or relationships, it could be a sign that they're struggling with OCD. Remember, these signs are not a diagnosis, and it's important to approach the conversation with sensitivity and empathy. Encouraging your loved one to seek professional help and support can be a positive step towards managing their OCD and improving their quality of life. Now that we've discussed the signs and symptoms of OCD, it's time to address some of the common myths surrounding this condition. According to the Anxiety and Depression Association of America, people with OCD are not crazy. While their symptoms may be distressing, they are not indicative of a person's overall sanity. OCD is not just a quirk or a habit. It's a recognized mental health condition that can significantly impact a person's life. People with OCD do not choose to have their obsessions and compulsions. These thoughts and behaviors are not under their conscious control. With the right support and treatment, people with OCD can lead fulfilling lives. By understanding and addressing the stigma surrounding OCD, we can create a more supportive and compassionate environment for those who are affected by this condition. We hope you found this video informative and helpful. If you or someone you know is struggling with OCD, please reach out to a mental health professional or contact an organization like the International OCD Foundation. We encourage you to subscribe to our channel for more content like this and to leave a like and comment down below. Your engagement helps us continue to create valuable content and reach those who need it. Thanks for watching. See you next time.